Good sleep brings better health. So let me ask you a question. How'd you sleep last night? For too many people, the answer is I didn't sleep very well. I'm pretty much dragging today. Data from the CDC backs that up. It shows that nearly 2 in 5 adults in Georgia are getting less than 7 hours of sleep a night. This comes out to more than 3 million people in the Peach State saying that they are struggling to get enough sleep. The percentage is well above the national average of around 1 in 3 adults. Here to find out what's keeping us up at night, Dr. Savitha Elam-Kootil, who practices internal medicine for Northside Hospital. Welcome to the show, doctor. Thanks for the time.
Thank you so much for having me, Cheryl. I actually practice with Kaiser Permanente, have been for many, many years. And as an internist who actually fell into sleep medicine because I saw it at home. My husband was diagnosed with sleep apnea, and learning about his situation and researching, I was fascinated with what sleep does to how sleep affects different parts of the brain and the body. And since then, it's just been rewarding to help people with their sleep issues.
Yeah, so it really started as something you experienced personally and then broadened out. I'm sure so many people will tell you in your practice, I'm just not a good sleeper. How do you even begin to unpack that medically?
It's not easy generally because they mention that at the very end, when they're done with all their major problems. Oh, by the way, I can't sleep. So I feel it's very, very important to take those 2, 3 extra minutes to kind of delve into why aren't you sleeping? And almost always it's insufficient sleep, sort of by design, especially since COVID. It's work life, including into your personal life. Um, so you sit down and take a quick sleep history and kind of unpack the many layers. And you see that people are drinking coffee after noon. They don't have any consistency to their bedtime or wake time. And they think 4 hours of sleep, they can do just fine with 4 hours of sleep. So these kind of misconceptions about sleep that you kind of chip away at that, give them handouts because you can't do it all in one visit. But it's extremely, extremely important to tell people why their sleep is such an important thing. Once you have that, once they internalize that, then the next steps of how it's easy peasy, I would say.
Easy peasy, because there is the medical reasoning for not getting good sleep. And then there are the choices that we make every day. Our to-do lists are long. And isn't it interesting? The first thing we seem to cut back on is rest, when that's got this direct, important relationship with our health. So what are the biggest red flags you see in patients who routinely shortchange their rest? Some things that might make them reconsider that choice?
Yeah, in the immediate aftermath of sleep deprivation, what happens is you just don't think straight. Your focus is off, you're irritable, you're an emotional mess. So I'm sure you know that Chernobyl, that nuclear disaster, happened because a sleep-deprived person was at the helm. Um, so things like this happen immediately, but if you let it go, and not too long, if you let it go just a bit longer, you really increase your risk of all kinds of chronic diseases, diabetes, heart disease, Alzheimer's disease. It can also impact your lifespan. How long you live might be determined by how much you choose to sleep.
Those are good incentives to sleep. We
Yeah.
only have a few seconds left, doctor. Really quickly, in Georgia, we're seeing some of the worst sleep numbers in the country. Why are we so far behind in that?
And I would chalk it down to, again, a lack of dissemination of the awareness of why sleep's important. Um, and I think that, the first line therapy or the first line treatment for sleep deprivation is cognitive behavioral therapy, helping people understand their wrong beliefs about sleep. There's not too many sleep specialists to go around, and there's not too many sleep therapists to go around,
All
and
right.
physicians are challenged with their time.
Well, I'm glad if awareness is the key, you have certainly helped us with that. Dr. Kootil, thank you so much for the time today.